everyone. I'm Allison Guttu from National Women's Liberation, and our group comes from a collaboration between Red Stockings of the Women's Liberation Movement and Gainesville Women's Liberation, which was the first women's liberation group founded in the South in '68. Another leader from National Women's Liberation is here today, Jenny Brown. And yes. I'd like to thank her for letting me draw from points that she made at the Healthcare Now Rally Day in DC at the end of July. And I'm also drawing from points that another comrade, Erin Mahoney, has made. We're selling our booklet, a Red Stockings organizing packet, Women's Liberation and National Healthcare, Confronting the Myth of America. Jenny's one of the authors. Please ask me about it afterwards, or ask Jenny, and please buy it. It's $10. So members of our group have been working with Healthcare Now actually since its inception. Most recently, I've been working with Healthcare Now, and I'm proud to say I sat down in the lobby of United Health Group on October 15th with 13 others and got arrested. And I've helped with some jail support and actions after that. So I'd like to tell you why women's liberation activists see the fight for national health care as a priority for our movement, and then talk about strategies. First of all, on the recent legislation, we think it's bad for women and bad for women's liberation for many, many reasons. And we thought that before the Stupak-Pitt Amendment, which is of course totally untenable. The point is there are many, many feminist reasons why we fight for single payer and why the current legislation messes women over, even if it didn't cut out abortion coverage. As abortion pioneer Cindy Sisler said, "We will not accept insults and call them steps in the right direction." And that's what we think about today. Okay, so why are women's liberation activists in this fight? It's not because women need more health care than men. It's not because we think women are particularly more caring. In fact, we'd like to stop being the safety net when our rotten health insurance system kicks people out quicker and sicker. It's not even that women are less likely to be insured. No, we say that the insurance company's stranglehold on our healthcare system is an obstacle to women's freedom and independence. How? Well, if you think back to the 50s and earlier, we had a male breadwinner system where men were paid more than women because women were supposed to be at home and men were supposed to be working to provide for a family. This was the family wage. The good thing about the family wage is that it did make employers pay into the unpaid care work that falls on women's backs. The bad part is the unfair wage gap between men and women that we're still feeling today. And it also entrenches a system where women are often dependent on a male partner for benefits, like health insurance. Because we still make less money than men do, women are the ones who take time off from paid work to do the care work, whether for children, aging parents, sick relatives. I'm sure you could add to that list a lot of women out here. We lose wages, promotions, social security benefits, and our health insurance, often making us dependent on a man for ourselves and our children's insurance. So we've heard from scores of women who have stayed in marriages that were unsafe or that they just didn't want to be in because of health insurance. So whereas feminists demand equality from men, we also need to tear down the structures that make us, the economic structures that make us dependent on the men in our lives. So we say stop tying healthcare to jobs and stop tying healthcare to marriage. The Red Stockings organizing packet that I was just telling you about promotes national health insurance in the context of a larger battle, and that's for the social wage. So what's the social wage? The social wage is an alternative to the family wage. It takes those fringe benefits, right? Like they're just these extra things. It takes these fringe benefits and makes them universal and paid for by the government. We see national health care as a springboard to winning other social wage universal programs that would give women more economic independence from men and employers and more time. So these are programs like paid maternity leave, paid paternity leave, and for universal child care. Okay, as for strategies, we've used first international comparisons. The myth that America is the best health care, the most liberated women, right? Everything is golden here. This really keeps us in the dark about what other countries have, and breaking this down is very powerful. Second, consciousness raising and speak outs. When I was in my first consciousness raising on healthcare, I testified about taking a job that I didn't want because I couldn't afford to continue paying out of pocket for healthcare while I was doing temp work. Hearing each woman talk about her own healthcare situation turned on a light bulb for me about how crazy it was to have to depend on a job for halfway affordable insurance. Not to mention all the women who were speaking about being in marriages or having to consider having to consider healthcare in terms of marriage and divorce. When we take our testimony public in a speak out, it has an impact too. People can identify with what we're saying, they see the same situations in their lives, and they get won over, and it helps our movement grow. Finally, I want to caution against a strategy that healthcare now has used at times. I'll call it the altruistic approach or worst case scenario. It's what leads people to think that universal coverage is about helping the poor and the needy, the people who are going bankrupt or someone else over there, but not them. Like talking points about someone who died or is dying, or focusing on the uninsured. While it's true that private insurance kills us, it does, most people don't think that will ever happen to them. And we really need to be getting more people to see their own stake in national health insurance. We need to be talking more about how insurance companies are screwing all of us, even when we're not sick, and even when we have insurance. And there are many ways to do that. For one, people here are getting less quality care than people in other countries do. Second, as for-profit premiums skyrocket, employers just pay more into premiums, right, rather than raise our wages. So US wages have fallen way behind other countries. Third, insurance directly affects how many hours we spend on the job. The high cost of health insurance leads employers demanding overtime from workers because it's cheaper to pay overtime than it is to hire more workers. Or they just hire workers part-time without insurance. And there's a whole section on overtime in the packet as well. As we're painfully aware, we need to fight hard and fight huge in order to win this. Let's keep talking about why national health insurance is good for all of us, not just for poor people or those without coverage. Why people should fight for national health insurance the way they fought to keep Social Security when Bush tried to privatize it, and about what they themselves have to gain from it. Thanks for all your great work.